Say for example, the doctor is treating a triple vessel disease. Three major vessels of this coronary artery is being affected. So the doctor is going to place a saphenous vein into these. He is going to create a bypass. In that case, you will have to report the code only from the venous section. Say for example, it's a number of graft is 3 vessels being treated. They are taking the venous graft. So you will have to report the code 33512. Is that clear? Now, if the provider is going to treat these diseased coronary arteries via an arterial graft, then you will have to report the code from the arterial section, which commences from 33533 and 534. The problem now becomes when the provider is going to treat this diseased vessels through both an arterial and a venous graft. In that case, you will have to report the code for the arterial graft first, and then for the venous graft, you will have to report the vein graft add-on code separately. Here, the vein graft becomes a plus code. That's the only difference. You will have to see whether the CABG is done via the veins, report the code based on the number of vessels that are being treated. Fine. 3 venous grafts being placed on 3 separate vessels, report that code alone. You will have to see the number of venous graft. Again, you will have to go and see for the number of arterial grafts. If both is being done, now what happens? The vein code becomes a plus code. That's the only difference. And you can report the harvest of other arteries like upper extremity artery or lower extremity vein or the femoropoplitieal vein separately, except the saphenous vein. When you will be coding the saphenous vein is only when it is harvested endoscopically, and the code for that is 33508.